if we don't have the quality of life, we're not going to have the quantity.
Welcome to the Grit Unfiltered podcast. I'm Lauren Listowskis, cancer survivor, caregiver, and advocate. September is Childhood Cancer Awareness Month, and today we're joined by Morgan, a childhood cancer survivor, to hear about her experience navigating cancer during her childhood. Hi, Morgan.
Hi, Lauren.
Thanks for joining us today. I'm excited to have you and just thank you again for talking with us and being open and sharing a little bit about your experience.
Yeah, of course. Thank you so much for having me.
Yeah, so we'll just jump right in, get to it. Can you share a little bit about yourself and your cancer experience?
Absolutely. So I was diagnosed with a very rare form of soft tissue sarcoma called alveolar soft part sarcoma just before my sixth birthday. And it's been kind of an ongoing battle since then. It originated in my right thigh, attached to my muscle there, and then it metastasized to my lungs. And it has been stable for more than 15 years, which we're really happy about.
Awesome.
Um, but so I'm technically not in remission. I'm just considered stable since I still have those nodules, but we are watching them every 6 months. And so it's just been an ongoing battle ever since pretty much I was six.
Well, thank you. And so you were diagnosed when you were 6, and if you don't mind sharing, how old are you now?
Yeah, so now I'm 28. We'll be 29 in December.
Awesome. Another December birthday. I like it.
Yeah.
Um, and so you said you're kind of, you're not considered in remission because you do have some nodules they're keeping an eye on over time. What is that like for you to still have this kind of wait and see surveillance period, even, years and years and years later that this has followed you?
Yeah, it's very anxiety ridden and constant worry for me. Every 6 months, I go and do my scans and check up with my oncologist. We do scans of my chest and look at my lungs. They do scans of my leg. And then, as well, they scan my brain because if it moves next, when it moves next, if it'll move next, it will move to my brain next. So that's something they always want to keep an eye on. And that's kind of my most anxiety ridden form of that is just always the what if, and is it going to come back, is it going to grow, is it going to move, and even though I've been stable for more than 15 years, it's just always heavy on your heart, and it never really goes away. So
Right. Right. Yeah. It's a tough place to be, and that kind of wait and see what happens, if, when. It's really a
yeah,
toss up that can really just totally throw off, I guess you could say, normal life.
absolutely. It's
Yeah.
definitely it disrupts work. It disrupts, your everyday life. Even that weeks leading up to that 6 month appointment is just very difficult. And my oncologist tries to get my results back to me as soon as possible, which I really appreciate. But there's just always that waiting period, and it is it's difficult and it's heavy. It's very heavy.
Absolutely. I get that. I know I'm a mess and, we'll say nicely irritable.
Yeah.
And it's, an appointment week, and everyone kinda knows, how to treat me or handle me, I guess you could say, like a fragile little package.
Yeah.
So, totally understand that there. So, we've kind of obviously just talked a little bit about the anxiety and the mental health aspect, of your childhood cancer following you into adulthood and surveillance and monitoring. Are there any other challenges you have found, over time from treatments or anything like that, whether it's physical things or emotional, anything that's kind of followed you now into adulthood?
Yeah, absolutely. I have many physical issues post-cancer treatment and surgery. I was very lucky that I did not do chemo. I say lucky, but who is
Right.
really when they're diagnosed with cancer. But we did surgical intervention in my thigh and my lungs, and then radiation to my thigh. And now, since treatment and since intervention, due to the radiation, all of the lymph nodes in my right thigh, like groin area, are completely shot and destroyed, which has led me to have lymphedema in that right leg. So anything with extreme heat, with extreme cold, walking a lot, my foot, my leg just swells up like crazy and it gets numb and all of that. And on top of that, when I was a junior in college, I broke my femur, and that was kind of a side effect of the radiation intervention. So basically, it just made that bone really, really brittle, and they honestly were surprised that it lasted that long. But it did eventually break, and I have a carbon fiber rod in there now, but because that bone is just so destroyed, it's still in two pieces, and it's a constant, every day hurt and challenge for me. Um, just, walking, taking a walk at lunch, anything like that is difficult. I can't walk my dog like I would like to. It just, every day, I don't know what to expect. So that's really difficult, as far as physical attributes, in my leg. My lungs definitely, because I still have nodules there, my lung capacity is much less than others. So I
Right.
can't like blow up a balloon or things like that, and I get winded easily. So that's difficult. And then you have the emotional toll, of course, just of dealing with this your entire life, and everything that goes along with that. So
Right. And, since you did have surgical intervention and, still dealing with, that troublesome leg and the surgeries over time, you know, just kind of wondering when you were growing up or even now, from those surgeries and everything, if, does your, or even with the lymphedema, does the appearance of your leg look different than other people?
yeah, it definitely does. Because my tumor was attached to my muscle, they had to pretty much scrape all of that muscle off of my leg, for my bone. And so when they immediately did radiation right after, that tissue that was in my leg just bound right down to the bone and put scar tissue on there. So now I have no muscle buildup on the top of my leg where my quad is. And so there's a big difference from my left leg to my right leg, and it's difficulty finding clothes that fit, finding jeans. I went through a stage when I was in elementary school where I thought I only wanted to wear skirts because I felt like my leg would show less if I wore skirts, because I wouldn't see that indentation if I was wearing jeans. And of course, definitely just finding shoes that fit. I mean, I'm constantly wearing tennis shoes. Thank gosh that they're in style now. love I love a good sneaker. I love wearing sneakers with my dresses or anything like that. But I mainly wear sneakers because I'm trying to keep that foot from swelling up. And if I'm wearing sandals or if I'm wearing heels or anything like that, it affects. It's a long term, building back up for a whole week trying to get the swelling back down. So it affects pretty much everything. And I've spent a lot of time trying to deal with those difference in appearances to everyone else. And now I feel very confident in myself, and I appreciate my body and know that my body, has brought me to where I am today. But when I was little, I mean, it was very difficult. Kids are mean. So, and they don't try to be, right? But they say what they think, and they say what's on their mind. So it was very
Right.
difficult growing up. But I think having a very supportive parents and supportive friends really helped me to just kind of regain that confidence. Um, so it's taken a while, but I'm there. So
Right. Yeah. Well, that's great. I know, anybody that looks remotely different, especially, when you and I were younger was a really big deal growing up. And so I'm sure that was really difficult to, be the different kid, right? At school or birthday parties, things like that. So I'm glad you've, definitely worked through that and have gotten to a place where you can feel confident and feel comfortable in your body, even through the discomfort.
yeah, absolutely. I definitely, it's funny that you mentioned birthday parties because it kind of brought me back to when I was little. And my mom is actually the one that kind of pushed me towards this part in my life where I'm now stable. But she took me off of all sugar when I was younger. And that kind of helped my body to just regulate and stay stable and those cancer nodules to be, not grow. But in doing that, as a 7, 8 year old kid at a birthday party, I wasn't allowed to have birthday cake with everyone else. I wasn't allowed to have ice cream, couldn't have all the treats in school, anything like that. My mom did a really good job about, you know, bringing alternatives and trying to normalize and make it as normal as possible for me and not, you know, it helped me to not notice that difference, but it was difficult, even not only did I look different, but now here I am even more so being pointed out because I can't even eat birthday cake with everyone else.
Right. And, speaking of things you missed out on, I'm sure, even though you didn't necessarily have chemo with the surgeries and radiation, I'm sure you, had to miss school and things like that. So just wondering, how did that affect you and what other things might have missed out on when you were growing up?
Yeah. So luckily I did not I'm not behind in school, even though a lot of my friends and former cancer survivors that has affected them a lot. But I never had to miss too much school, was always able to keep on track. But definitely in my my hobbies that I did, I was a avid competitive dancer. My sister was a competitive dancer and I always wanted to be like her, but having surgery on your leg and radiation on your leg and being in a wheelchair, crutches, whatever it may be, it I wasn't able to do those things. And I had wonderful dance teachers and wonderful cheerleading coaches and whatever that made accommodations, but it was always difficult for me, and definitely missed out on certain things. And even now, I miss out on things because if, say, me and my friends are going out on the town and we want to go to dinner and have a few drinks, well, I can't walk a mile to our next location. I got to get an Uber or I got to take a pedicab. I'm in Charleston, but it's definitely difficult. I don't want to be, laying in bed for the entire day the next day, just because I had to walk what seems like to most a short little bit, but to me, it can put me out for a couple days.
Right. And, I'm sure that's hard of finding that balance of taking care of yourself and not wanting to overdo it, but then you're also not wanting to, you know, over explain or then burden your friends that you're going out with and kind of be that, difficult person, but at the same time knowing I got to do what I got to do or I'm going to be laid up in bed for a week.
Yeah. I College was difficult after I broke my leg. It was my senior year of college and that's your prime time. I loved it, but my entire senior year pretty much I had a cane because of that femur break and because it my bone wouldn't heal. So I had a cane for my 21st birthday. I had a cane walking to classes, and I went to USC, and so it is a very walkable campus, but to me, it's not a walkable campus. So I lived on a hill. I would take my cane up and down that hill. We would go out, but I would take my cane and I was able to adapt, but it was difficult, of course. My apartment was on the third floor. We lived in an old house and I loved my house that I lived in, but it had no elevator. So I was taking one step at a time with my cane every single time I had to go up or down the stairs. And so it took me three times as long
Right.
compared to, just a year prior where I was going up and down no problem. But it was just that weird freak accident of my femur breaking and just that bone being brittle. And, I'm put out for my entire senior year of college.
Wow, I can't imagine. Um, so aside from, you mentioned your mom and your sister and having a good support system, were there any organizations or other support systems outside of your direct family that, helped you then back when you were diagnosed or through childhood or even now?
Yeah, so Camp Happy Days, which is a nonprofit organization supporting kids with cancer and their families, based out of Charleston, was my biggest support system and where I found so many friends and who are now family. I am still heavily involved with them and volunteer every year. I'm on camp planning for them, but their flagship program is a week-long summer camp where kids with cancer just and their siblings get to come and basically do things that we don't get the opportunity to do at home and feel like a normal kid, be able to connect with other kids with cancer, even though genuinely every single one of us have a very unique situation. But we all are bonded by this awful C word, cancer. So it's good for the siblings as well to be able to connect, and because it affects the whole family. But when I was younger, having that space for my sister and I to go and, be without our parents, but also just be with people that were like us. I found my best friends, my counselors at Camp Happy Days were my mentors and now my best friends that I hang out with them all the time and have just made me into the woman that I am today. And not only did they provide financial support when needed, they come visit you while you're in the hospital. They do dream days for kids. I mean, it is just the most amazing organization. And I've met a lot of wonderful people. Unfortunately, some of my friends that I met through there have passed on and due to cancer or other reasons related to cancer. But I'm very, very grateful for the friendships and family that I've grown through Camp Happy Days.
Yeah, I know, just knowing you're not alone and knowing there's other people like you is so important, and I can't, you know, imagine how much more important that is, growing up as a child dealing with this. And, I think it's just, speaks volumes to the meaningful connections you made and how life-changing an experience is like that, like Camp Happy Days and what they provide that, you went there as a kid with cancer, right? And your sister and as a child, as a camper, and then now you're still involved and you still go to camp as an adult and help out and, help other children that were, you were in their shoes before. I think that's really just remarkable and important that there are organizations and support and opportunities for connection out there.
Yeah, it's so amazing. I mean, I talked about my friends and my mentors, and not only that, but I met my late husband through there as well. And one of the biggest reasons and things that we connected on, obviously, was us having cancer, but it was something so special about that. Me explaining my cancer story was something so easy, and the first thing that I did with him rather than with another partner. It comes a little bit later. It's a little bit more difficult. I have to explain, oh, well, I can't walk to this place or I can't do this and that. But it was such a weight lifted off of my shoulders to have a partner who truly understood what I went through. And so I'm very grateful for camp and grateful for him, but just the bond that we created through that. He had osteosarcoma, and unfortunately, he passed away in 2018. But I'm so grateful for the time that I had with him, and it just really shows you how important organizations like Camp Happy Days are, just to make connections and um, some of my campers have the same oncologist as I do, and so it's fun to not fun, but it's good connection to my campers to say, "Oh my gosh, yeah, I have Dr. Kriveka as my oncologist. I understand what you're going through," and just support them. And if they can see that I'm an adult and I'm pushing through and I'm
Right.
successful, then they also have that hope and um, desire to want to keep going and keep pushing.
Right, just having that, like you said, almost mentor and those adult relationships that, hey, this person was my age at this time and they got through it and look at them and they get to come back to camp and are living life. I think that does, like you said, provide a lot of hope and motivation and really just help with that desire to keep going, outside of medical intervention and treatment. There is, that mental piece too of, really wanting to live, and kids are very resilient, but at the same time, children with cancer are even more resilient, and I almost hate saying it, right? But it's just an unfortunate piece of it is having to go through that and be resilient.
I think
Um
they're so like so many people say, "Oh, you're so strong." Well, I mean, strong was just we had to be. There was
yeah.
no
Yeah.
we were given this, and we kind of said, "Okay, deal with it." And half of it is your mental, um, your mental thoughts throughout all of that, and really wanting to live and wanting to like push through. And like you said, as a kid, kids are so resilient, and it's a not easier, but it's there's no brainer like, yeah, I'm going to get through this. Yeah, I'm going to live. And it gets a little bit more difficult when you get into those teens and 20s years where it really weighs heavy on you. And so many things are changing. And not only do you have all these life changes, but you also have cancer on the back of your brain. And unfortunately, some people just can't mentally handle
Right.
that.
Yeah.
Really, really
Exactly.
difficult.
Yeah. So, beyond kind of finding connection and finding other children you could relate to, and then even now staying involved and being in the cancer space and helping others, even though, again, you were a kid and growing up, were there any moments where you felt really empowered or, kind of in control during your cancer experience, even though cancer is so much out of our control?
Yeah, I think my parents did such a good job of being an advocate for me, but also letting me be an advocate for myself. Um, Especially in my teen years, once I got to be 13 and the lymphedema started to flare up and all of that, they really allowed me to kind of take control of my body. And your body best. And so they knew that I have a very high pain tolerance, but if I say it's hurting and we need to go to the doctor, it's really hurting, and they're gonna make it happen to where they're getting me in so quickly. So I am really lucky that my parents allow me to be an advocate for myself. And so it really now in my 20s and my late 20s, really, I feel like I'm powerful when I go to the doctor because I am in charge of my own body. And if I don't feel like something's right, I'm going to push as hard as I can to get answers for that because you are in charge of your own body and you know what's right and wrong. So
Absolutely. Yeah, and that's, I mean, I say it till I'm blue in the face and out of breath that you have to advocate for yourself, pay
yeah,
attention to your body, and it's almost a double-edged sword. I feel like as cancer survivors, we are so aware, and it's a benefit, but it's also really scary,
yeah.
to be in that space and be like, you know what, something's up, something is not right here, and I'm really serious. So I'm gonna go in there and put my foot down and really get something done versus kind of play more of a passive role in your healthcare or the healthcare system.
I've had so many. I During COVID, actually, I was running a lot, which is pretty much the only physical activity that you could do at the time because all the gyms were closed and all of that. But I'm not supposed to be running with my leg, right? That's not really something that is a good activity for me. But because of that, and because I was overcompensating for my right leg, my left knee actually, I ended up having a partially torn meniscus, a fractured tibia, and my MCL was sprained. And so immediately I was like, something's wrong. Like this is weird. Something's wrong. And when I went to the ortho that I saw, they wanted to focus on my right leg and always wanted to focus on that side. And honestly, we're so intrigued by my health story and by everything that I've lived through. And I was like, okay, I get it, but that's not why I'm here. There's something going on, and this is wrong. And he basically was just like, well, I mean, I think you just might have overworked it, and sent me on my way. And I called my oncologist and I said, no, this isn't, there's definitely something worse happening. And she got me in with someone else, and immediately they did an MRI and saw all of that stuff and kind of looked at me and they were like, how are you still walking?
Oh my gosh. Yeah.
You're resilient. We're built to be strong and resilient. And it is what it is. I knew something was wrong, but am I gonna not go to work? Am I not gonna do all that? No, I have to continue on with my life. And yeah, I am advocating for myself and trying to find answers, but life doesn't stop. So
Right.
you got to just keep moving. But I do feel like I was proud of myself for advocating for in that moment.
Absolutely. Because if you have, just the way the healthcare system is, and it's, the doctor says what to do and the patient does it. And, luckily and thankfully, we're shifting away and growing and developing into a better, healthcare setting to where patients really are more in charge and get to kind of steer the ship a lot more, which, I'm sure you can agree is how it should be.
Yeah,
But that you had that strength and that knowledge just from everything you went through to say, "No, this isn't right," and we're able to call your oncologist, who I'm sure you trust, and feel really supported by. So, that's really awesome.
yeah, definitely.
Also kind of wondering, obviously, I was diagnosed when I was 23 with cancer, and that has clearly impacted and kind of changed my life path, my career path, now working in the cancer world with Grit Health. Um, is there anything that, has kind of outside of your strength and, being confident and everything like that as an adult, has cancer kind of shifted or shaped your future at all in some ways?
Yeah, absolutely. I definitely knew I always wanted to work in the healthcare realm and healthcare world since I was very young. And I definitely think that me being a patient, a cancer patient, led me to that. Um, and especially in my role now, I work in GYN oncology, doing complex care coordination. And working in the oncology setting has just been so amazing to me, even though GYN oncology is so different than childhood cancer and sarcoma, even. It is just being able to talk to these patients and kind of reassure them. And I'm really lucky that I'm the first voice that they hear whenever they're calling in and are getting a referral to us. And I'm very grateful that I have that experience. It sounds weird that I'm grateful that I have cancer and am able to relate, but there's something special about that. And I feel like I do have a calming presence because of what I've been through. So
Absolutely.
has led me in that direction. And I'm in grad school right now to get my master's in counseling, and to eventually work in sex therapy. And so I think because of all of the things that I've seen in the oncology realm and seeing how much it affects someone's sex life and um, anything, really everything in your life. But for in my experience, especially working in GYN oncology, I'm like, I want to help these people, and I want to do talk therapy and help them through that portion of their life, something that's so simple that we're supposed to be able to talk about and want and need, but cancer kind of destroys that for us sometimes.
Yeah,
So that kind of has
absolutely.
direction as well.
Yeah, like you said, it might sound kind of weird, but when I worked in a clinical healthcare setting, I felt prepared, I guess, to have those tough conversations or be, not just be there as somebody in the office, but to really, really be there for someone because I've been through it. And I wanted to be that person, when I worked in clinic of the person maybe that I didn't get to have,
Yeah.
right? Or, the kindness or that mutual understanding of having that shared experience, I think, again, as weird as it sounds, really makes a difference when you're talking to somebody, at the doctor's office or on the phone or anything like that, and they can actually relate to you because they've been through something like cancer. I think it really makes a difference in the care.
Yeah, I definitely, I don't get to see patients face to face often, but I'm going to be that person that will sit on the phone with them for 30 to 45 minutes if they need to talk and they just need to vent and let it out. I know that how that feels. And sometimes, they don't even need a response. It's just them venting and them literally going through the most difficult time in their life. And you being that listening ear and just allowing them to sit on the phone with you to 30, 45 minutes is all they need. And
Yep.
so some of them may not have the support systems that I had or that, some of my friends had. And that person on the phone may be the only person that they're able to talk to about their diagnosis. And I'm no medical provider, I'm no doctor, so they can't ask me any medical questions, but they're just genuinely sharing their emotions and their feelings and their fears in this first step of their oncology journey. And so I feel that me sitting there and listening to them, whereas some of my coworkers may not do that and may rush them through. And I work with amazing people, but just having that backstory of being a
Mhm.
patient really makes a difference.
Yeah, and it even goes back to, what you said when you were, a kid and going to Camp Happy Days and things like that is, yeah, everyone's cancer experience is very unique to them and very different. And, your cancer from my cancer and, the next door neighbor, everyone's is very different. But at the end of the day, it is still a really, I want to say special, but screw special because it sucks. But it's that underlying connection and at its core, a shared experience that even though it's different, it's still very relatable and we get it. We've been there, we've done it. And it
Yeah.
just, really sets the playing field, I feel like, and can really foster deeper and more meaningful conversations and connections for sure.
Yeah, absolutely. I'm really grateful too that the Boone Project in Charleston is a organization for young adults with cancer, and so through Camp Happy Days, we're able to kind of push them through that next gap, so that way they don't once they turn 18, yes, they're done with Camp Happy Days, our cancer kids, but now they get to have fun with the Boom Project. And that's something that for me has been wonderful because now I get to connect with adults. Not only at Camp Happy Days was I able to connect with kids, but just being able to connect with other people that are my same age. And like you said, like especially there, everyone's story is so, so different, but we all have that shared experience. And whether it's going to get cocktails or doing a book sale or trying a new yoga place out, like whatever it may be, we just all kind of come together and are able to just have a good time and relax and get our minds off of cancer.
Right. And, it's, again, I always laugh at myself when I say it, but I'm like, I have my normal friends and then I
Yeah.
have my cancer friends. And it's just, especially in today's age of technology and how many, virtual offerings there are, like Grit Health or other organizations. And I think, teenagers and young adults, really flock to technology and the internet for that support. But Man, the first time you get to hang out in person with other cancer patients or survivors,
Yeah.
it's just it's crazy. You feel like you already know these people because you already have that kind of bond already, you know?
Absolutely. I love, like, just sharing experiences too, because to my normal friends, maybe something that I think is funny that happened to me, but maybe a little bit traumatic, like in a cancer realm, is funny with my cancer friends, and we get to laugh about it and make humor and light out of our situation that just makes us feel a little bit better. And it brightens our hearts and makes us feel happy.
Right. Yeah, I always have to check myself and remind
Yeah.
myself who I'm hanging out with because my sense of humor is a little
Yeah.
twisted, and I think that's kind of a really common theme in, adolescents and young adults in the cancer space too. And, a joke with my cancer friends, they're all gonna laugh and think it's hilarious. And other people would be like, "Oh my God, I can't believe she just said that. Is she okay? Like,
Yeah.
that's really messed up." I'm
Yeah,
like,
they
"No,
kind of
it's a joke. It's funny. Come on." Like.
absolutely.
And so building off a little bit, you mentioning the Boone Project and how that is for adolescents and young adults, that nonprofit, um, and kind of talking about that transition from teen years and childhood into adulthood and young adulthood, and even, now approaching, your 30s, and I'm in my 30s. What was the transition like for you going from being, a pediatric cancer patient to, moving off pediatric care and into adult care? What was that like?
Yeah, so my situation is a little bit more unique, I think, than others. Transitioning might be because my type of cancer is so rare. My pediatric oncologist, kind of said, I want you to stick with me. And so I'm pretty much going to be treated by her or seen by her for however long I need to, just because really, this type of cancer is so rare that no one else has a great grasp on it. Um, and so Dr. Kriveka has been with me for 22 years, and she knows the ins and outs. And she also, every single time I see her, she's always like, "Hey, I'm constantly like looking for new studies and looking to see if there's any new treatments out there." So I know that she has my best interests at heart. So it is a little bit different. It's weird going into a pediatric clinic as an adult, and definitely like they're like, "Where's your kid?" I'm like, "No, no, I'm the patient." But I am very grateful that my oncologist, has so much love for me and wants to keep with me, and also I trust her. So also think that definitely the fact that I'm not in remission has is just different too, because I go in every 6 months, whereas, most people who were diagnosed at 6 probably are going every year, maybe every 5 years.
Right.
So to get their checkups. So my situation is definitely unique to others, but um I'm just really grateful for the care that I've had.
Yeah, I mean, I can't imagine, having the same doctor, the same provider for 22 years, and what that relationship must be like, and how much trust and understanding and just respect also. That's crazy. That's amazing.
I mean, every
Um,
single time I go, she asks about my family. She asks about my parents. She asks about my sister. She asks, "How is she in California?" She knows every single aspect of my life. And now going to appointments with my boyfriend, like, it's different, but she's so supportive and has seen me through every stage of my life. It's weird because I just went to my first primary care doctor visit like a month ago, and I told him, I said, it's weird because I pretty much just use my oncologist as my primary care physician for so long because she's my home base. Like, she is my person that knows me in and out, and I trust her with everything. I trust her with my life, obviously. So, uh,
Mhm.
it's definitely, it was weird, but also, I've seen her throughout every pregnancy that she's had. Her kids are in college now. Like, it's a different type of relationship, but I'm really, really grateful.
Yeah, I mean, she's essentially seen you grow up and you've seen her, grow up through her career as, a doctor. That's really special.
Yeah.
Um, so obviously, you're very lucky to have that, relationship with your provider, and I'm sure you've heard it can be very different for other people and what that's like. So just kind of wondering if you have, you know, from things you've heard or seen, or even you yourself working in healthcare now, is there anything you wish the healthcare system did differently for cancer patients and survivors?
I know that, and I could talk about this till I'm blue in the face, but childhood cancer research only gets 4% allocated by the National Cancer Institute for research. Only 4% out of all the different types of cancer that kids may have. And yet, our research has come so far that we are seeing much higher survival rates than when I was 6 years old. But we're also not looking at long term side effects of these treatments that we're giving to kids. So, yes, we may have treated them and cured them, and they are now living past 5 years past diagnosis. But 10 years down the line, how is this going to affect them? What organs are getting destroyed by the toxic chemo that we gave them way back in the day, because really there was no research on how to give the specific type of chemo to a child.
Yep.
So we take adult chemos and we just kind of make them smaller and give them a smaller dose. And to a 40-year-old or a 50-year-old, 10 years post diagnosis is a wonderful achievement. But for that kid, they should be living 50 to 60 more years. And we genuinely don't have the research, or, we don't have the funds to look into specialized treatments for childhood cancer patients.
Right. Yeah. And you make a great point of, funding and research and new treatments and new therapies and participating in research and clinical trials, or even, studies about survivorship and long-term
Yeah,
side effects that aren't, a clinical trial per se, but other types of patient experience research is just so important, because if that's not done, there are no new treatments.
yeah,
And I think that's a really important thing that has to be said out loud, that if there's no research that's being funded, there are no new treatments. And
yeah,
that can drastically change, not just the course of someone's life today in treatment as a child, but like you said, we're talking 50, 60 years down the road. And these kids have a whole life to live in front of them. And what's the impact in their 20s, their 30s, their 40s? And even like you said, something really important to you is, sexual health and sexual well-being, and what does that look like after all this? And I think that's really important.
yeah,
Because I see, at least, being diagnosed in my early 20s, I might hear, well, everything you're feeling and going through and experiencing, long-term side effect, or, you know, sexual drive, or any sexual health stuff, or, fatigue or weight gain. Oh, that's very normal. I'm like, I
mhm,
get that that's normal for what I went through, but that's not my normal. And it's not the normal that I want to live. So help me get to where I want to be
yeah.
living, you know?
It's quality of life, and it I know that we want to have quality and quantity, right? But if we don't have the quality of life, we're not going to have the quantity, because
Right,
the quality of life is what drives our mental health and how we're feeling and all of that. And that's what allows us to have that quantity of life.
right,
So I, it's definitely difficult for me because, I've had friends that I met when I was younger who have not passed away from their cancer itself, and they were in remission for many, many years, but they passed away from side effects or even mental health related to their treatments that they received when they were kids.
Right.
So it was because of their quality of life not being acknowledged and not being treated that it unfortunately led them
Mhm.
to them passing. And it's very sad that we don't talk about it more and we don't have that research and that funding.
Right, because even treatment is one thing, but then, that chapter closes and you have all these years to live, especially like I said, with children, they have
Yeah.
their whole life ahead of them. So we're not just talking about 5, 10, 15 year survival rates and survivorship. It's way bigger than that. So thank you for sharing that.
Yeah,
Is there anything else you wanted to add before we wrap up?
I don't think so.
Okay, awesome. Well, thank you so much. This was great. And I just really appreciate you taking the time and shedding a little bit of light on your experience as a childhood cancer survivor and how that has followed you and impacted your life as an adult. So, yeah, thank you again, Morgan. It was great chatting with you.
Yeah, of course. Thank you so much for having me.